Good afternoon, everyone. I'm Dr. Rodriguez. I'm a general and bariatric surgeon. I've been doing this, um, helping people losing weight with surgery for over 15 years. I did a fellowship, which is basically a specialized training just doing these type of surgeries, and I completed that in USF in 2012, and I've been in the area here in South Florida for about 5 years doing general surgery, invasive surgery, and weight loss surgery. So we're very excited about trying to provide some information as a webinar for you guys and in general for our patients. Obviously, I will encourage everyone to get a little bit more information. Go to our website. If you have any questions or any concerns or any more information that we can give you at the end, please just let us know and contact us. Certainly, obesity has been considered now a disease just like hypertension or coronary artery problems for a while now. But with the recent pandemic of COVID-19, it has exposed something that a lot of people may not be aware, where obesity is in essential a chronic disease and it's an inflammatory state. And what that does in part with the body is like decreases the capacity to fight other diseases. And that's why with the years where patients are obese and overweight, things and problems health-wise start accumulating. So again, with the COVID-19 pandemic, we have seen that patients with overweight and obesity, especially the ones that have other diseases associated with obesity, like diabetes, hypertension, or heart disease, have really not fared too well, where the patients that have obesity had a higher chance of being hospitalized, had a higher chance of being admitted to the intensive care unit, and also had a higher chance of succumbing to the disease and having a prolonged hospital stay, the ones that recover from it. So there's no such thing as really obese and healthy. It's just obese and basically waiting for other things to accumulate. And one of those that are most prevalent is diabetes, where they basically go hand in hand. We're gonna expose that. But what are the things that cause obesity? Why are we, so overweight? Why do we have so many issues controlling it? And part of it is the way we live and the way, the accessibility to foods that are not necessarily healthy, and our lifestyle where we're, spending more time sitting down and not being physically active as before. But there's multiple components to this and multiple things that contribute to the obesity problem. One definitely is overeating. If you have an excess of calories that your body is not burning through on every day, basically accumulates, uh, with time. And that the environmental factors have a lot to do with it because, the body is designed to adapt to its environment the best it can. And when you have this, when we live in an area or a life, full of stress where we're not eating well, we're not, exercising and being physically active, and we're not sleeping well, all this basically have a cumulative effect in our body where it starts stressing it out. And one of the responses to that is accumulating fat tissue and gaining weight through the periods of time. We also have seen that how our body interacts with this environment also changes our genetic composition, and that's one of the ways it adapts to it. But in the obesity problem, it actually kind of works against us, where the body starts thinking that it needs to be in a certain way. Um, and when you try to fight that and try to decrease weight, it kind of fights you back. And it's kind of a self-sabotage issue that we're going to go into a little bit more in details. Certainly, we have a lot of patients that are female, and they have seen that after their have kids and they go to the pregnancy stages, they're not able to lose some of that weight that they gain through that process, and we see that through the years it becomes more difficult and more difficult. A lot of medications like for depression or medications for our heart can also decrease your metabolism a little bit in a way that makes you fight those extra calories a little bit harder. Um, there are also other components to it, which is the genetics composition and our family history, where, if our parents are obese, we have a higher likelihood to become obese as well. And part of the environmental factors and our way of life is the lack of exercise, where again we're spending a lot more time uh, not being physically active, or kind of a sedentary type of life. And all those on its own contribute to the weight issue and makes it a little bit harder to fight. So, and that's why there is no one magic pill, or there's no one magic strategy that can decrease, the obesity problem, and that's why losing weight is so hard for most people. Certainly is a significant problem. Over 240 million diabetic people worldwide, but in the United States specifically, it's about 30% of the population. That's a significant amount. And again, obesity and diabetes, they go hand in hand. And we have seen maybe a decrease in the numbers lately, but not significant enough that we think that we're gaining on it. Um, One of the issues with diabetes is that it's very difficult to treat. We see that not even half of the patients that have diabetes have a good glucose control. And if you know anybody that has fight this disease, you see that they start with one medication and then they say, "Oh, this is not working. We need to add another one or change the strategy." And then with the years, it becomes more difficult and more difficult because the body doesn't respond to these treatments anymore, and then they need insulin, and then they need more insulin, and they keep increasing the dose. So it's a very difficult to fight disease. And the problems with it is all the related issues, just like diabetes, sorry, just like obesity, affects basically every part of the body. Diabetes kind of does the same, where you have the neuropathy, the problem with the eyes, problem with the kidneys, problem losing weight, arthritis, and problems, with sensation in general. And again, this kind of fits into itself, where as we gain weight or as we go through the years, it just becomes more difficult to control. And one of the main problems that we see is in our younger population, where we see that 1 in 5 adolescents and 1 in 4 young adults are having pre-diabetes, and that's just a precursor. That's just basically the body saying that the insulin that the body is producing is not enough anymore, and it's not enough to call it diabetes, but with the years it's just going that way, and that's a very alarming number. And again, the is a global health threat in the way that it's obviously very costly, not only financial wise, but on a personal toll. Having to go to the doctor, changing medications, and having to be hospitalized every so often with these type of problems, it becomes a hindrance. Um, the numbers are alarming. Like I said, the last year that we have numbers for 2018, and it's almost 27 million people in the United States alone. And then of those, 210,000 are children and adolescents. So, and those are patients or, kids that are going to become adults with these health issues. And then they're going to carry that through the adult years. And the problem with that is that, decreases their overall health, quality of life, and life expectancy. The earlier they start, the more difficult to control the problem will become. uh, with the years. So, and these are the numbers. This is self-reported data, and we know that sometimes we're not completely true to ourselves as far as our height and weight, but we see that in the middle states, some of these states the obesity rate is over 35%, which is alarming. And in our state in Florida, we're talking about 25 to 30% obesity rate, and we think it's actually a little bit higher than that. And as we have seen through the years, there 10 years ago, 20 years ago, there were a lot of states that were in green where the obesity rates were less than 20%, but that's not the case anymore. On the contrary, we see that most of these states have gone, higher and higher. And like I said before, I think that the most alarming aspect of this is our children and adolescents are having these problems. And definitely, the way we eat is probably the one of the most important contributing factor, but also our genetics and how our body is interacting with our environment is affecting not only us but our children. And again, that's something that we kind of have to deal with as they grow older. And now is the time to start doing and changing our strategy to try to provide a better future for them as well. And again, one of the ways that we classify obesity is basically by their body mass index, where depending on their height and their weight, you're gonna fall into one of these categories over here. And the more severe ones is a BMI above 40. And I have a table over here where basically for your typical 5'4", 5'5", female is once we're talking about 180 to 200 pounds, they're in the obese range. And for that same person, if we are talking about 230 pounds or so, they're on this extremely obese or severe obesity where a BMI is above 40. And those are the patients that we start considering, or let's put it this way, we know that in this population, just trying to eat a little bit healthier and exercise may not be enough to provide enough weight loss to decrease this qualification over here. And as we talk BMI, the higher the BMI, the higher the chances of having related diseases to obesity, which we're gonna go in details, but probably the most important one, fearsome one, is diabetes. We see that especially in females, as the BMI goes higher, the chances of and the incidence of type 2 diabetes goes higher as well. And the higher the BMI, the more incidence of it. So what are the things that we can do? Obviously, once primary doctors usually try to monitor your weight and your body mass index, and they usually tell you to, to try to eat a little bit better and exercise. But the reality of it is that, in my opinion, everybody needs to become a nutritionist, and most importantly, understand how your body specifically responds to the different types of diet and your particular environment. We see obviously that not every diet or every health style works for everyone, but in general, we know that the added sugars have a detrimental effect in our overall health, and limiting carbohydrates in general is a good idea, as well as increasing the lean types of proteins and the vegetable-based proteins is something that works for most people. Whole grains in general and fruits and vegetables are considered, the kind of the mainstay of a healthy diet. Definitely increasing physical activity will help you control some of the calories that we burn, and will give you a little bit of a booster. But for most people, they need a little bit more. Another strategy is definitely, how we live in the pace of life right now is really fast, and we sometimes don't get enough time for sleep and for ourselves, and definitely the amount of stress that we're living through has a detrimental effect in our health in general, but also obesity specifically, as we uh, a lot of people that would come to us, they have a stress eating disorder where either they're happy or they're sad. They cope with food sometimes because it's comforting, makes us feel good in the moment, but in the long term it has definitely a detrimental effect in our overall health. So these are the things that we can control. Obviously it takes time and effort to try to um, you know get in tune with all the things that are healthy for our body, but those are the things that we need to start or focus on. Educating ourselves, reading about it, and understanding our body are probably the most important ones. But again, for most people, this just may not be enough. For them, the patients that come to us is because they have tried to eat healthier, they have tried to be more active for years, and they have had some degrees of success where they lose some weight, but they're not able to maintain that weight. And part of it is not only the things that we do, because most of the time we get tired of eating healthy or doing any type of diet uh, well, for about 4 weeks or so. Most people don't even make it to 4 weeks, and then that's when we see that maybe the body will start uh, doing some changes. So we don't see the results as we are looking for them, but they come kind of in a later stage. And again, we live in an era of instant gratification, where we're gonna see the results right away, and that takes a lot of time. And metabolic surgery in general are gonna provide faster results. It's not gonna be instantly, but it's gonna provide a little bit more weight loss for your effort in a way that you can see it and keep motivated. And we're gonna go into some of the details of surgery themselves, but definitely we see that surgery is the best tool that we have to combat this obesity issue, where helps you control the amount of food that you can eat, and also provides those results that you're looking for in a way that keeps you trying to do all the things that we instruct, as far as the diet and the kind of program in general, bariatric surgery wise. So these are the two main procedures, and then let me see if we can start one. The older procedure is the gastric bypass, still one of the best tools that we have in order to provide weight loss. Still the gold standard of surgery, as it's called, where we basically make a small pouch out of the upper part of the stomach, right? We separate the bigger stomach from the pouch. And what that does is that, you cannot eat as much. And then the next thing we do is that we reroute how the food goes to the body in a way that not everything that is eaten is absorbed. So it's a more metabolically active procedure. The weight loss is, as good as it gets as far as surgery goes. Um, the average weight loss is somewhere around 100, 120 pounds. And the chances of weight regain are less with this type of procedure. It's a very safe procedure. We have it, technically, all the aspects are more standardized now, and it has changed through the years, but now it's again very safe, very standard procedure that we do. And this is one of the main the best strategy to combat diabetes specifically. Once you have obesity and diabetes, it's one of the procedures that you should really consider. The next one is the gastric sleeve. It's a little bit more popular. We've been doing more sleeve now than gastric bypass because it's a very safe, again, very straightforward procedure where what we do is divide the stomach in two and make a tube out of the stomach. The excess stomach is removed, which is about 80-85% of the stomach. Sometimes a little bit more, sometimes a little bit less. And one of the advantages is we don't change the anatomy, where how the food goes to the body is essentially the same. You only have a smaller stomach, so you feel fuller faster. And we think that it has some other metabolic changes where it changes your hunger cycle and some of the hormones that are produced in the intestines. But one of the when we compare the two operations, one of the questions that we're asked frequently is like, what is the best procedure for me? And that's always a tough question because it's very individualized. We need to look at the details of what are your goals, what what's your health history, what medications you're on, and also what what are you trying to achieve with surgery in general. Those are the factors that contribute to for us making a decision. But what we see is that when we compare bariatric surgery or metabolic surgery with diet and exercise, I mean, the results are you cannot simply obtain these results with diet and exercise. I mean, the remission of diabetes and the heart issues and blood pressure issues are just amazing compared to just trying to control it. I mean, we're able to in most patients decrease the need of these medications that they're taking, and for us is one of the most joyful achievement where patients basically come with several medications and they leave with no medication, only maybe an antacid or the vitamins that we require them to take. The improvement in quality of life is unmeasurable in some cases because they're able to do so much more and enjoy their life without having to worry about their weight or the effects that the weight have on their lives. It definitely increases the your life expectancy and reduces the healthcare costs. And in general, we think that these type of surgeries in the long run pay for themselves in healthcare savings. Again, there are other diseases that are related to obesity that also improve. And again, it's not like a magic pill or anything. It's just the metabolic changes in your body and also the extra effort that you put in order to obtain these results is what makes surgery successful. We see that definitely, like I said before, obesity affects every part of the body, from head to toe, and most of those things are able to be resolved and not significantly improve with surgery. We have a program that is basically dedicated to these type of patients and these type of surgeries. Is a nationally accredited program. We are board certified and fellowship trained. It's a multidisciplinary approach. All our patients go through nutritional assessment and a psychological evaluation in preparation for surgery. We do a general checkup, and we usually like to also do an endoscopy to make sure that the stomach is ready for surgery in preparation for it. We have a bariatric coordinator that basically takes the patients through the process, hand by hand, and constant communication. We have a registered dietitian that works exclusively with our patients, and we basically the hospital is tailored to care for the bariatric patients in general. This is our accreditations. Basically, we have put up all the work as far as obtaining all these credentials. And again, we've been doing this for a very long time. This is some of the pictures. So you can, again, access our social media and our webpage to see some of the testimonials and see some of the patients that have gone through this before. And I think that by now, bariatric surgery is very well accepted and, sought after a strategy to combat obesity. And obviously, we're very proud of what we do and what we have achieved. So those are my 2 cents. I hope you enjoy it. And if you have any questions, I'm happy to answer them.
Yes, thank you, Dr. Rodriguez. Just an amazing presentation and educational as well. There are some questions that we have here. We've been receiving them throughout your presentation. The first one is, should I postpone surgery during COVID?
Well, that's a great question. We have proposed this question to our society, and our general consensus, especially now that the numbers are going down, is that we don't think so, you know. And the reason why is, again, we have seen that obese patients have, you know, done you know, a little bit worse compared to the general population in the COVID-19 pandemic. Our hospitals are very safe with, you know, in-hospital transmissions are basically none. You know, most of the people that have contracted the diseases is community acquired. We have not had any issues. We have continued to do these operations. Obviously, at the beginning, we stopped there for a while just because we didn't understand enough of it. But as we have seen and continue to get more information about this virus and how it relates to the other diseases, we still think that is safe. We are doing them, and obviously there's a little bit of a process, so nothing is immediate. But uh, in general, our recommendation is to start the process and make decisions as we go, as far as changes or anything like that. But we are performing these operations. We resumed doing them for a while now, and we have had no reportable issues.
Wonderful. The next question is, how do I find out if I am eligible for surgery?
So that's one of the questions that we get often. You know, we have a BMI calculator in our website, and we also will ask some questions about your general health. But the criteria, basically, it depends on the BMI and the history. If you have a BMI above, or body mass index, which again depends on your height and your weight, above 35, and you have other related diseases like hypertension, diabetes, coronary artery disease, hyperlipidemia, or sleep apnea, and things like that. Those are the things that the insurances will look for in order to approve you for surgery. And if you have a BMI above 40, then basically automatically qualifies you for surgery.
Wonderful. Next question is, how much time off work do I need in order to recover from surgery?
In general, we recommend that if you can take about at least a week to 10 days off. Ideally, most patients will benefit from taking 2 weeks, but I have seen most of our patients, they go back to work, you know, after 5 to 7 days. Obviously, everybody's a little bit different. Some people take a little bit longer, some people take a little bit less, and especially in these times where most people have the ability to work from home, then, you know, basically you can go back whenever you feel like it. But for physical work and physical activity, we probably recommend at least 10 days off.
Okay. Thank you, Dr. Rod. Next question, which we discussed, how long is the process? What is the cost, and is it covered by insurance?
Yeah, so again, those are the questions that we often get asked. The process itself, it all depends on insurances. Yes, some insurances cover it. It all depends on, again, the fine print of the policies. You know, even within insurance, like let's say Blue Cross or Blue Shield, even within them, they have like different policies, and it's always a good idea to check. You know, they have a customer service line where you can call and ask specifically about coverage for bariatric surgery. Otherwise, obviously there's always a cash option. And the process itself, again, takes in average, I would say, somewhere between 6 and 8 weeks to get somebody through, again, all the bariatric process, which includes the nutritional evaluation, psychological evaluation, and the general checkups. Um, but sometimes it takes a little bit longer depending on insurance requirements, because they may ask for a little bit more documentation, or they may ask for, you know, extra evaluations from other surgeons, or I mean, from other practitioners as well.
And then our last question, for an individual with no medical history or taking any medications, which surgery would you recommend for that individual? And do any of these procedures require a hospital stay?
Great question. So, you know, it's always tricky when they say they have no medical issues. That's why we do kind of a thorough questionnaire about their history and the symptoms. And sometimes we always find that some people get used to some of these symptoms and they don't even recognize it as a medical problem. Let's say, for example, knee pain. That people just kind of live with pain and they don't associate that to the weight. Also reflux. People get kind of used to taking a medication for the reflux, and they don't associate it with reflux, with weight or obesity. So we go through all the details as far as trying to obtain a thorough history and exam, trying to see what the starting point is. For most patients, I would say that a sleeve gastrectomy is enough as far as the weight that they're trying to achieve, and also the health benefits. I would say that a sleeve is basically a straightforward operation. They very safe. The chances of complications are very, very low, and with no medical issues, I would say that a sleeve is probably appropriate. However, once we go into the details, then we can tailor specifically to the patient, because sometimes that recommendation may change depending on their history. Um, and I think that was a question, right? Or there was a second part of that?
Yeah, no, that was it. It was the length of the duration for a hospital stay.
Oh yeah. So for most patients, even though we can probably do the operation where they can go home the same day, we like to keep them overnight, at least one night, for observation. I would say 90% of the patients go home the next day with no problems.
And then in terms of self-pay or cash pay, what would be the range? Because I know there are, it's not just a simple procedure where you can just go in and say, X amount of dollars. If there are additional um, areas that need to be addressed, what would you would consider the range being from a low standard to a little more complex case?
For most people, the range is somewhere between 12 and 14. There are some issues that, or some steps that may be covered by insurance, and we may be able to put them through that, and there are some that are not. But I would say, that's the range for like out-of-pocket expenses. And obviously, if you call or talk to one of our teams, they can give you the breakdown specifically, so you can see everything that entails. If you have any more questions or anything else that we can do, please just let us know through one of our ways of communication, either direct messaging or emails or call. We'll be happy to help.